Hi, welcome to our YouTube video channel. Today we will talk about influenza symptoms, diagnostic treatment. Influenza flu can cause mild to severe illness, and at times can lead to death. Flu is different from a cold. Flu usually comes on suddenly. People who have flu often feel some or all of these symptoms: fever or feeling feverish chills, cough, sore throat, runny or stuffy nose, muscle or body aches, headaches, fatigue, tiredness. Some people may have vomiting and diarrhea, though this is more common in children than adults. When to go to the doctor or come to the hospital. Most people with the flu do not require medical care or testing. If your child has a fever and symptoms, such as cough, sore throat, runny nose, or a stuffy nose, call their doctor before coming to the hospital. The doctor will decide if your child needs to come to the hospital or not. Also call your child's doctor if your child is under 5 and has flu symptoms. Diagnosis: your doctor will conduct a physical exam, look for signs and symptoms of influenza, and possibly order a test that detects influenza viruses. During times when influenza is widespread, you may not need to be tested for influenza. Your doctor may diagnose you based on your signs and symptoms. In some cases, your doctor may suggest that you be tested for influenza. He or she may use various tests to diagnose influenza. Polymerase chain reaction (PCR) testing is becoming more common in many hospitals and labs. This test may be done while you're in your doctor's office or in the hospital. PCR testing is more sensitive than other tests and may be able to identify the influenza strain. Treatment: usually you'll need nothing more than bed rest and plenty of fluids to treat the flu. But if you have severe infection or are at higher risk for complications, your doctor may prescribe an antiviral medication such as oseltamivir, Tamiflu, zanamivir, Relenza, Paramivir, Rapivab, or Baloxavir, Xofluza. These drugs may short your illness by a day or so and help prevent serious complications. Oseltamivir is an oral medication. Zanamivir is inhaled through a device similar to an asthma inhaler and shouldn't be used by anyone with certain chronic respiratory problems such as asthma and lung disease. Antiviral medication side effects may include nausea and vomiting. These side effects may be lessened if the drug is taken with food. Most circulating strains of influenza have become resistant to amantadine and rimantadine, flumidine, which are older antiviral drugs that are no longer recommended. Clinical trials: explore Mayo Clinic studies testing new treatments, interventions, and tests as a means to prevent, detect, treat, or manage this disease. Lifestyle and home remedies: if you do come down with the flu, these measures may help ease your symptoms. Drink plenty of liquids, choose water, juice, and warm soups to prevent dehydration. Rest, get more sleep to help your immune system fight infection. You may need to change your activity level depending on your symptoms. Consider pain relievers. Use an over-the-counter pain reliever such as acetaminophen, Tylenol, others, or ibuprofen, Advil, Motrin, others to combat the achiness associated with influenza. Children and teens recovering from flu